the increased infections. The advice, however, we've received is that taking this step now would not necessarily achieve a significant reduction in the rate of transmission, and would also come at a great and extraordinary economic cost, putting more livelihoods at risk and potentially causing long-lasting social harm. As we now approach the peak of infections, we need to take extra precautions and tighten existing measures to slow down the rate of transmission. And on the recommendations of the National Coronavirus Command Council, Cabinet, and after consulting the Provincial Coordinating Council, which is made up of premiers and MECs, Cabinet has therefore decided that the country will remain at a level 3 at this stage. But that we should, however, strengthen the enforcement of existing regulations and take certain additional measures. In order to reduce the rate of transmission, we had earlier said that the wearing of cloth masks will be mandatory. While many South Africans are wearing masks, there are, however, some amongst us who are not wearing masks when they are in public. It is therefore important that we should enforce the wearing of masks. Regulations on the wearing of masks will be strengthened. Employers, shop owners and managers, public transport operators and managers, and owners of any other public building are now legally obliged to ensure that anyone entering their premises or facilities or vehicle must be wearing a mask. All workplaces and all institutions need to ensure that there is a designated official responsible for making sure that all regulations and all precautions about all this are strictly adhered to. Taxis undertaking long trips will have to adhere to a 70% occupancy, but those who are undertaking local trips will be permitted to increase their capacity to 100%. And this will be on condition that new risk mitigation protocols related to masks, vehicle sanitation, and open windows are followed. As we head towards the peak of infections, it is vital that we do not burden our clinics and hospitals with alcohol-related injuries that could have been avoided. This is a fight to save every life, and we at the same time need to save every bed in our health facilities. We have therefore decided that in order to conserve hospital capacity, in order to make sure that there are sufficient and enough beds in our hospitals that are not taken by those who come in resulting from alcohol-induced trauma or injuries. We've now decided that the sale, the dispensing, and the distribution of alcohol will be suspended with immediate effect. There is now clear evidence that the resumption of alcohol sales has resulted in substantial pressure being put on hospitals, including trauma and ICU units, due to motor vehicle accidents, violence, as well as related trauma that are alcohol-induced. Most of these and other trauma occur at night. Therefore, as an additional measure to reduce the pressure on hospitals. A curfew will be put in place between the hours of 9 p.m. and 4 a.m. Apart from people who need to travel to and from work or who need to seek urgent medical or other assistance during this time, everyone will be required to remain at home. The curfew will take effect from tomorrow, Monday the 13th, 2020 at 9 p.m. We are taking these measures fully aware that they impose unwelcome restrictions on people's lives and their movement. They are, however, necessary to see us through the peak of the disease. At the same time, we have decided to ease restrictions on activities that pose a lower risk of infection and are important for economic or educational purposes. As part of resuming economic activity, all auctions will be permitted subject to protocols similar to those that currently apply to agricultural auctions. Parks will be open for exercise, but not for any form of gathering. After careful consideration of expert advice, there are still some activities that present too much of a risk to permit at this stage. For this reason, family visits and other social activities will unfortunately not be allowed for now. I know that this places a great burden on families and individuals and can cause great emotional strain, especially for those with elderly parents. It goes against our very nature as social beings, but it is a hardship that we must endure for that much longer to protect those we love and those that we care for from this disease. To ensure